I'm Dr. Kapadia. Welcome everybody on this World Sight Day. World Sight Day is a global event which was started by Lions Club, and it's an international event in which we promote how exactly sight and vision is important for us. So today we are going to give you a brief outline regarding what World Sight Day is. At the same time, we'll also try to give you a brief into some eye diseases, so that these are common eye ailments. In a simple terminology, we'd like to explain what exactly they are. So I'll just try to share my screen. Right, so today we will be discussing protecting and taking care of your eyesight. What is importance of our vision? Eye is an important sensory organ. So there are a lot of anecdotes and a lot of expressions that we use as eyes are windows to the soul. Vision is a window to the world. With vision, we connect with others. With vision, we feel the happiness. 80% of our memories are determined by what we see. That's how the vision is important. World Sight Day is an annual global event which draws attention on blindness. It was started by Lions Club International. An objective is to create awareness regarding eye care, vision blindness, and treatments involved in curing eye ailments. This day focuses on the leading cause of blindness and visual impairment, such as cataract, glaucoma, refractive errors, etc. Why is it important to celebrate or commemorate this particular event? Because globally, there are 2.2 billion people who have unaddressed vision impairment or blindness, out of which 1 billion have vision impairment which could have been avoided. That means it's a treatable or avoidable cause of blindness. Approximately 2% of India's population is blind. Approximately 1.1 million people in India are blind because of corneal ailments. And more than 1 lakh corneal transplants are required annually in India, whereas currently we are at 25,000. So important is we need more corneal donors. Sight is a physical entity. It's a sensory experience in which light reflects off the object, and the eye then focuses this particular light. Signals are sent then to the brain, which converts these images, and the brain then interprets those images. So protecting your eyes and your sight is highly important. Little bit of anatomy. The eye is consisting of 3 basic structures: the anterior part or the forward part, which is the cornea and the iris and the pupil; the middle layer, which consists of the lens, ciliary body, suspensory ligament; and the posterior or the back part of the eye, which consists of the sclera, choroid, retina, and the optic nerve. We would like to discuss a few common eye problems. The common eye problems would be different in children and different in older individuals. Some of them being refractive errors, like the glasses. So what kind of glasses do people wear? Myopic, that is minus; hypermetropic, that is plus; and astigmatic, that is cylindrical. Then certain diseases like dry eyes, digital eye strain, allergic conjunctivitis, color blindness, and night blindness. These are very, very common eye diseases. Common eye problems in children could be lazy eyes, also called as amblyopia, strabismus, also commonly known as squint, and ptosis or the droopy lids. In older people, presbyopia or the near vision glasses, cataract, glaucoma, age-related macular degeneration, and diabetic-related diseases. These are common in older people. So let's begin with the first one, that is myopia, one of the very, very common entity in which we see every second person around us wearing glasses. So myopia is nearsightedness. In these cases, things which are near are clear, whereas things which are far are blurry. Eyeball is normally longer than the normal, and the image is formed in front of the retina. It's usually hereditary in nature, but it could be sporadic, seen in children between ages 8 to 12, but sometimes we can even find myopia in as early as 3 to 4 years. Patient may complain of squinting and headaches. Parents may complain that the child is going very close to the screen or very close to the notebook when the child writes. So that's one of the first symptoms. And treatment is by wearing spectacle glasses, by minus corrections and contact lenses. And when the patient is in appropriate age, that is adulthood, after the age of 18, laser refractive correction can completely cure this particular ailment. As opposed to this, we have hypermetropia or farsightedness, in which the distant objects are clear and the near ones are blurred, because the eyeball is a little shorter in length and the image is formed behind the eye. So when the patient is usually an older person over the age of 35 years of age, but it can also happen in children. Actually, children, most of the children are born with hypermetropia. That means a small eyeball. And slowly, as the child grows, till around by the age of around 2.5 to 3 years, the eyeball achieves its adult size and the eye becomes not hypermetropic anymore. Patient may also have trouble reading when the patient has hypermetropia or the plus glasses, and the patient may have headaches. Treatment is by wearing spectacle lenses of plus dioptric powers, contact lenses, and the laser refractive surgery after the appropriate age. Next, what is a lazy eye? We may see that there are some children who have an eye which is misaligned. Sometimes we see the children who are wearing some sort of an eye patch. So what exactly is lazy eye? It's an early childhood condition in which the child eyesight does not develop in one of the eyes. So the other eye is a very dominant eye and it takes all the function. And the eye which is lazy does not have any function. So that eye is being ignored by the brain. So vision is not normal, even if there is no obvious pathological condition. So we have an anecdote for this particular condition in which we say neither the patient nor the eye surgeon sees anything. That means we do not see any symptoms, we do not see any signs, but the patient's vision in one of the eye is not normal. So it's typically detected when a normal eye is covered. Till then, with both eyes open, the child can function normal. Early diagnosis is very important because the treatment is effective only if it is done in a very, very early age. Between the ages of 6 to 12, we have the best results. So treatment is by prescribing spectacles if the patient has unequal power. That is, if the one eye has no power and the other eye has, let's say, +3 or -3, then one needs to wear those spectacles. And also at the same time, one needs to patch the eye, which is a better eye. That means the lazy eye is the one which is going to work now, and the brain will increase stimulus to the lazy eye, and the vision in that eye will start improving. It can be diagnosed as early as 2 years of age, and then the underlying problems can be corrected. Astigmatism is a condition in which instead of a point focus, there is a focal line which is formed in either in front of the eye, in front of the retina, or behind the retina. Most of the astigmatism is because of the cornea-induced changes. The imperfection results in vision blurring, and it can be present in young children, or it could also happen during puberty. Patients can have running together of letters, headaches, eye strain, distorted vision, and the treatment is again similar to myopia and hypermetropia. That's wearing spectacle lenses, contact lenses, and refractive surgery at an appropriate age. What exactly is squint? Squint is nothing but misalignment of the two eyes. That means one eye is looking straight and the other eye is not looking at the object. So more commonly, it is also called as cross eyes. It commonly happens in infants, but we can also see it in adults. The condition causes misalignment in which one eye looks straight. The causes being muscle dysfunction, farsightedness, trauma, and genetics. It could be completely asymptomatic, or the patient may present with just the cosmetic symptoms. And the treatment is treat the cause first. That is, if the patient has a refractive error, then the glasses should be prescribed. We can give eye exercises. And if nothing works, then we can do a rectifying muscle surgery. Ptosis is a droopy eye in which one eye is normal and the other eye, the lid starts drooping down. And the droop may cover the eye slightly, but it can also sometimes cover the eye entirely and it can block the visual field as well as the vision. This is the condition in which, if in children, the drooping is covering the pupil or the center part of the eye, that means the vision is going to get obstructed and the eye may go into amblyopia. And that is the time that it needs to be treated at a much earlier age. It can also be because of hereditary problems, and it can obstruct natural development of the child's visual capacity. The condition does not become better on its own. So the child will definitely need treatment, and mostly the treatment of this condition is surgical. Now we come to the problems which are more in the adults, that is corneal ulcer. Ulcer is nothing but an infection or a sore of the cornea. Cornea is the central part of the eye, which is the transparent layer, and it often caused by the infections or injuries, also called as keratitis. The causes being bacterial infection or the viral or the fungal or the parasitic infections. It presents as redness, foreign body sensation, actual discharge from the eye, lot of pain, lot of photophobia, swollen lids, and sometimes patient may come and say that they can see white spot in front of their eye or on top of the eye. Treatment, depending upon what kind of infection it is, you can give an antibiotic or antiviral or antifungal or antiparasitic drops. But sometimes, in spite of everything, ulcers may progress and one may need surgery, which we need to replace the cornea by the corneal grafting. Conjunctivitis is something that is very, very common, also called as pink eye, sore eyes, in which there is actual inflammation or infection of the conjunctiva. That is the white portion, the transparent layer which covers the white portion is called as conjunctiva. It is commonly bacterial or viral, or sometimes it is also allergic. It can be very, very irritating. It can happen because of allergies, foreign objects in the eye. The symptoms being redness, itching, gritty sensation, discharge, and lots of watering. This is one condition in which prevention is better. Prevention is by good hygiene, not touching your eyes unnecessarily, washing your hands often, and using a clean towel and good personal hygiene. Treatment, usually we need to give symptomatic relief unless we prove that it is because of bacterial in origin, then we can give antibiotics. Sometimes we can give antivirals, and we can even give anti-allergics. If the patient is wearing contact lenses, then they are advised to stop the contact lenses completely. Cataract is very, very common disease in old age, in which it is a clouding or the normal crystalline or the clear lens. It starts becoming cloudy. It is a treatable blindness, and patient sees as if patient is seeing through the frosty or the fogged up window. So there is blurred vision, there is clouded vision, there is dim vision. There can be halos around the light. There can be problems in the night driving, faded view of colors, and causes. Most important cause is age-related cause. It means it's a senile cause. As we age, our natural lens, which is protecting us from the ultraviolet rays, by filtering the ultraviolet rays and not allowing the rays to go into the retina, eventually the lens itself takes the damage of the ultraviolet rays, and then it starts becoming opaque. So that is an age-related cataract, which is the most common. The other causes being eye injury, hypertension, diabetes, hormone replacement, etc. So what exactly is the treatment of cataract? There is only one treatment of cataract: surgery. Cataract cannot be cured by any of the eye drops, but early kind of cataracts, which has very small visual impairment, can be corrected with just the glasses. Still the patient's vision becomes all right. But as the cataract progresses, eventually we need to do a cataract surgery. So when do we consider surgery? When the cataract starts obstructing day-to-day vision, when it starts disturbing patient's life, that's like dim vision, halos, night vision problems, glares, etc. So what exactly we do in cataract surgery? Cataract surgery is a simple surgery in which we remove the crystalline or the clouded lens and we implant an artificial lens. There are various ways in which this can be done. The technology has evolved now in such a manner that we can reduce the incision size to as small as 2 millimeters. And we use certain equipments like phacoemulsification or laser surgeries. We have laser equipment to even cut the lenses into pieces. And then we have phacoemulsification, which is an ultrasonic probe which emulsifies and it absorbs or sucks the lens out through a very, very small incision. The lenses which are then implanted are typically the foldable lenses, which would go through a very small incision of 2.5 millimeters, the size of the lens being around 6 millimeters. So it opens up inside and it folds. This is now a daycare surgery, no anesthesia, no injection, no stitches, no dark glasses. So we just give some protective glasses for maybe 2 to 3 days, and the patient is told to avoid going out for maybe 1 or 2 days so that the infection does not happen. And the antibiotic drops are given for 7 days, anti-inflammatory drops are given for 2 to 3 weeks, and maybe some lubricating eye drops, which would be given. Healing usually starts within 48 hours, and it is complete within 1 or 2 weeks. Final healing may take, depending upon what kind of cataract or what kind of underlying condition is, it may take 6 to 8 weeks. As opposed to this, glaucoma is a condition in which the intraocular pressure of the eye goes up. So when the patient starts experiencing that the vision has started to reduce, that means at least 25% of glaucoma has already set in. And the problem with glaucoma is that whatever vision is gone, it is completely gone. We cannot restore the vision by getting the pressure down. So suppose the normal intraocular pressure being below 20, around between 14 to 18 is a normal intraocular pressure. If we detect that the intraocular pressure is 24 and we detect that there is some amount of damage to the patient's vision, then when we reduce the pressure from 24 to 14, that vision which is lost, it does not come back. So basically we are going to prevent further deterioration, and that is why glaucoma is a condition which needs to be diagnosed very, very early. Over here, it happens because of buildup of high intraocular pressure. The excessive amount of fluid gets collected inside the eye and then it does not drain out. Risk factors are patient's high age and the family history of glaucoma, and it is also high risk for patients with diabetes, heart disease, and blood pressure. Even patients who are on certain medications like steroid can also develop this condition. Diagnosis consists of specialized tests like tonometry, which is an eye pressure, gonioscopy, in which we see the patient's angle of the eye. We also do optic nerve head imaging, perimetry, which is the field of vision, and we measure the thickness of the cornea, which is also called as pachymetry. So it is treated by lowering the eye pressure with the help of drops. And if the drops do not help, then we can go in for laser treatment, we can go in for surgery, or we could have a combined approach in which we do almost all the treatment together in case the patient has a long-standing or an end-stage glaucoma disease. Treatment of glaucoma is to reduce the eye pressure. Depending upon how much the eye pressure is initially, we need to give that much amount of treatment. Sometimes it is 1 drug, sometimes it is 2 drugs, sometimes it is 4 drugs. So nowadays, we have very good drugs available for glaucoma in which the patient has to just put 1 eye drop at bedtime and the pressure can get controlled. So it does not affect the normal working or normal daily routine of the patient, and the drugs are effective. If the medicines are not effective, then we need to do laser therapy, which is called as laser trabeculoplasty. If that fails as well, then we do filtering surgeries like trabeculectomy, and we may even put drainage tubes and minimally invasive glaucoma surgery or MIGS. Next, we go to a condition called as age-related macular degeneration. It is a medical condition in which the center vision is lost. Patient find it hard to recognize faces, hard to drive. Sometimes visual hallucinations happen. We divide this into the wet ARMD and the dry ARMD. In the wet ARMD, new blood vessels grow, and in the dry ARMD, the waste products collect underneath. There are risk factors like hereditary, smoking, and obesity. Diagnosis is done by a specialized test called as OCT or optical coherence tomography and fundus fluorescein angiography. For a dry ARMD, unfortunately, there is no definitive treatment available, but we give certain antioxidant tablets like vitamin A, vitamin C, carotenoids, lutein, astaxanthin. There are a lot of these drugs which are being tried. Whereas for the wet ARMD, in which there are actual blood vessels, we give certain injections inside the eye. They are called as the anti-VEGF injections. It will help to slow or stop the progression of the disease. Final very important disease that we want to discuss is diabetic retinopathy, because diabetes is one of the leading causes for the eye problems. It is a complication which affects the eyes and basically the retina. So in a single sentence, if I have to mention what exactly is diabetic retinopathy, it is actually a microangiopathy. That means the small blood vessels of the body, they get affected, they become leaky, and the blood starts leaking out. So at first, just like most of the diseases in the eye, it may cause no symptoms, or it may cause such mild visual disturbances that patient will just ignore it. But it is a silent killer. It will eventually lead to blindness. The condition can develop in anyone with any diabetes, and the longer is the diabetes, less controlled the sugar is, it's more likely that the patient can develop diabetes. Symptoms like seeing spots or dark strings, or blurred vision, fluctuating vision, impaired color vision, or dark areas in the vision. Risk factor, the most important risk factor is the duration of diabetes. So the ETDRS study says that after 15 years of diabetes, irrespective of the diabetic control, patient may manifest some amount of diabetic retinopathy. Next is the poor control of the sugar level. And if the patient has high blood pressure and high cholesterol, and if the patient is using tobacco, then the chance of diabetic retinopathy increases even further. Treatment is again towards slowing and stopping the progression. So very, very important to have a regular follow-up. Patients of diabetes should have minimum once in a year follow-up for the first 10 years of diabetes. After that, it should be once in 6 months. And if at any point of time, the doctor detects a diabetic retinopathy in the patient's eye, then the frequency of the follow-up should be as much as even once in 3 months, or whatever is directed by your surgeon. Eye strain is one of the very, very common thing now with the corona pandemic. The amount of screen time is increased. That is the reason why you are seeing me in front of the screen instead of in the physical presence. So the term eye strain describes a group of symptoms which occur in some patients after extended use of eyes. And the patients are extremely uncomfortable because of extended computer time and extended use of mobile, gaming, etc. In some cases, signs and symptoms are because of the sign of underlying eye conditions, and the underlying condition should be treated. Overexposure can harm the eyes in the form of blurred vision, irritation, burning, watering, redness, headache, disorientation, and difficulty in focusing. Due to COVID-19 lockdown, what exactly have we done? Television watching increased minimum, these are minimum figures, minimum 6%. News on TV, 57%. Smartphone usage, 6.2%. Video on demand, 3%. Chatting, 23%. Social media, 25%. So if in a nutshell, I have to say, 1.5 times is the minimum time which is increased for any common individual during the corona pandemic. The screen time is increased 1.5 times minimum. So what is the impact on our daily vision? Difficulty in reading, difficulty in shopping, difficulty in cleaning and dusting, and difficulty on working on laptop, desktop. So tips to prevent this. Practice eye distancing. That is, keep your mobile phones, keep your tabs, keep your laptops 25 inches away, lower the brightness, follow the 20-20-20 rule. That is, every 20 minutes, look 20 feet away for 20 seconds. Wash your eyes regularly, use nighttime settings, you turn off some devices at night, and try to blink much more. And most important now is need for regular eye checkup. An eye examination involves a series of tests to evaluate your vision and to check your eye diseases. Each eye test in the examination evaluates a different aspect of your vision, and an eye examination helps detect eye problems in that earlier stage. So the regular eye checkups will lead to early detection of the eye disease and to help us treat better. How, when exactly to do the eye checkup? In adults, every 5 to 10 years in the first 20 to 30 years, every 2 to 4 years for 40 to 54, every 1 year to 3 years in 55 to 64, and every year after the age of 65. And if at all any disease is detected, then it should be as frequent as whatever is directed by your doctor. So we take a pledge today on the World Health Day that we will donate our eyes because we have a huge shortage of cornea and we need to help the visually impaired to see the beauty of the life. So thank you very much. With this, I conclude our talk. And I hope this particular talk gave you enough information regarding the regular eye diseases and regular eye checkup and how to reduce eye strain. So thank you very much.
So thank you so very much, sir, for sharing your insights. And it will be surely helpful for the patients to encourage themselves for, for going for regular eye checkups and caring about their own vision and caring about their own quality of life and lifestyle. So once again, on behalf of Sentence, sir, I thank you so very much, sir, for sparing your valuable time for, spreading awareness for the patients for this noble cause. And looking forward for such meetings, sir, for patient care as well as for academic interest, sir. And we will be sharing, sir, a YouTube link with you, which you can subsequently share it across with your